breaking news on that high-stakes decision on boosters. The FDA has now authorized a booster dose of Pfizer's COVID-19 vaccine, which means millions could now receive a shot as soon as Friday. The decision paves the way for Americans 65 and older and those who are at risk, including frontline workers, to get that extra protection very soon. A CDC advisory board will also weigh in on who should get the boosters and when. But tonight there are also questions about moving ahead with boosters while more than 65% of the rest of the world still has not been vaccinated. Many simply have not had the access. Today, President Biden pledged to give 3 shots to the global community for every 1 shot here. And a glimmer of hope tonight as more Americans get vaccinated. The CDC out with a forecast that suggests cases, hospitalizations and deaths will begin to go down. And by next March, the worst may be behind us. Our Steve Osunsami leads us off from the CDC in Atlanta tonight.
The FDA is saying yes tonight to the Pfizer booster shots, which means that Americans who've already gotten 2 shots of the Pfizer vaccine could get a 3rd as early as Friday.
It's a reasonable decision to provide a 3rd dose to people for whom it appears that immunity is waning and severe infection is an increasing risk in the age of Delta.
At the CDC, they're still debating tonight who all should be getting the extra shot, focusing on people who are 65 and older or who have health conditions that put them at greater risk to COVID, or frontline workers like nurses or grocery store workers. The shots are already making a difference. Our medical team has found that in states where the fewest people are vaccinated, the death rates are nearly 4 times higher than in states that lead the country in vaccinations. Health officials now believe that an extra dose will eventually become the new standard.
At the end of the day, I believe the correct regimen is going to be 2 doses at first and a few months later, a 3rd dose. For J&J, it'll be the 1st dose, followed a few months later by the 2nd dose.
Americans who've gotten the Moderna and Johnson & Johnson vaccines will have to wait at least a few weeks for approval from the federal government on boosters. But already 2 million Americans with compromised immune systems have been cleared to get a 3rd shot from Pfizer. 34-year-old Allison Rogers has Crohn's disease. She got her extra shot in Portland.
I wouldn't be too hesitant about it, especially if you've already gotten the 2nd one. The 3rd one is kind of a breeze. I got it on a Saturday, and by Monday I was back at work.
All this planning for millions of booster shots for Americans have people around the world looking sideways at drug makers, wondering why they're not sharing their formulas with manufacturers in countries where there isn't enough vaccine to go around. On a virtual COVID summit today with the United Nations, President Biden announced that the U.S. is now agreeing to buy another 500 million doses of the Pfizer vaccine for the rest of the world, for a total of 1.1 billion doses that America is giving to people overseas.
For every 1 shot we've administered to date in America, we have now committed to do 3 shots to the rest of the world.
President Biden trying to promote some vaccine equality worldwide. Steve Osunsami joins us now from the CDC. Steve, President Biden pledging to help the world, but the numbers right now show a long way to go in order to reach his goal of 70% of the world vaccinated by this time next year.
That's right. The numbers show that about 32% of the world has been vaccinated. The Biden administration has sort of moved that goal. They're trying to see if that they can raise that number to about 40% of the world vaccinated by the end of this year. And one of the ways they're, of course, trying to do that is by donating vaccines to other countries where there is, of course, great issues about getting the amount that they need to get people vaccinated and get those vaccines distributed. Linsey.
And Steve, there's a new forecast out tonight looking at COVID cases through March. Walk us through that.
So this is a new forecast that looks at cases and the number of deaths. And researchers tonight say that it looks hopeful. And when they look at this model, it tells them that they're expecting to see the number of cases and deaths to continue to fall through the spring. And that is, of course, if we don't see an outbreak of another dangerous variant. Linsey?
Yeah, fingers crossed on that. Steve Osunsami, our thanks to you. Joining us now to give us more context about all things COVID, especially those booster shots, is ABC News medical contributor Dr. Darien Sutton. Doctor, thanks so much for joining us tonight. Let's get right into it. Who should and shouldn't be lining up for a booster shot?
Well, the official jury is still out as the FDA is waiting to reconvene for their official decision tomorrow. And then, as was stated, we'll likely see recommendations from the CDC after that. I suspect that the votes are very clear. It seems to focus on those who are high risk in terms of those who are over the age of 65 and or those who are immune compromised or immune suppressed. And also now we're starting to talk about the discussion of including those who are highly exposed, people like myself and other emergency physicians who may not fall in any term of a high risk category, but in terms of our high risk of exposure, it's still prevalent. So I'm suspecting that there will be a lot of discussions on how to protect both of these groups.
And what about people who've already had COVID and experienced some kind of natural immunity? Should they be getting another dose?
This is a great question, and it's something that is probably one of the most common questions I've been getting. Does natural immunity exist? And I'll have to say, in short, it does. But there's a lot of issues around that. We've seen some preprint studies and studies that have yet to be peer-reviewed that have helped us to understand that those who have had a recent infection are unlikely to get reinfected. But we also know that those who have had natural infections have variability in their immune responses. And we also know that we don't officially have a test to confirm who is immune and who isn't. And we know that those who have been naturally infected and subsequently get vaccinated have the highest level of protection. So my recommendation stands, as for most of the doctors in America, is our recommendation, which is that regardless of your past infection status, you should get vaccinated.
And there have been some who have questioned the booster shot is really exactly the same, correct? So if you had the Pfizer, the first shot and the second shot, this is the third shot, which is just like the first and second that you had, correct?
This is just like the first and second, respective to Pfizer. I suspect that as time goes on, we'll see some more results from Moderna regarding their booster vaccine, because I do know that they have lowered the volume. So I think that when that discussion comes into play, that volume of the third dose of the Moderna vaccine might be lower than the first two.
Helpful to understand that. And where do we stand now in terms of treatments for COVID, like remdesivir and monoclonal antibody treatments?
We have come so long in terms of where we started. Initially in this pandemic, as you know, I was fighting this pandemic in Queens, New York, which was the epicenter of our first outbreak. And I can best describe that as a controlled, or not even controlled, chaos and crisis. And since that time has progressed, we've begun to understand what COVID-19 looks like, who is at risk, and medications have come into play, including but not limited to things like remdesivir, the antiviral medication, Regeneron, the synthetic antibody, as well as prednisone and other immune modulators. We're using them every day. But I have to say that COVID-19 is an intricate and become quite complicated of a disease. So we use them with the understanding that each and every patient is different. But all of that being said, the one treatment that prevents the progression of COVID-19 to hospitalization and death that we know is effective and safe is vaccines.
And so that being said, what would you say to people who are willing to risk being unvaccinated and then put their hopes in these treatments instead?
I think that when patients bring that discussion to me, I realize that they have an understanding or misunderstanding of risk, and they're weighing the risk in different proportions, which is not necessarily accurate. We do know that COVID-19 vaccines have been heavily studied and they've proven effective in keeping people out of the hospital. And waiting for a miracle treatment while you're unvaccinated during an ongoing pandemic, or choosing a medication that might provide you more risk in terms of any benefit at all, is really the highest risk option. So it remains to stand that the lowest risk option to prevent your course of disease, hospitalization, and death from COVID-19, and even prevent you from getting infected and possibly transmitting it to others, is still getting vaccinated.
The state of Tennessee announced that they'll reserve the use of monoclonal treatments for the most vulnerable, which essentially means the unvaccinated who then become infected. Why would they do that?
When I look at this, it's a center of frustration that I have. And I have to say that we're looking at Tennessee, which is one of the lowest vaccination rate states, deal with a crisis and rationing care. And in the setting of almost 2 years of a pandemic in a highly industrialized country like the United States, we should not have this issue 2 years after the onset of this pandemic. And when I see that, I understand that each and every patient has a responsibility to themselves, but I try to redirect my frustration to those who are creating this misinformation and leading these people to picking high-risk decisions that they may not realize is high risk. I think, unfortunately, we'll continue to see this until we have more of that 45% of the American population vaccinated.
Do you believe that an unvaccinated person who gets COVID carries any level of responsibility for choosing to not get the shot?
I think that they do. I personally think that they do. But again, when I'm looking and talking to a patient who is making that decision and choosing a higher risk option, I inform them that, when we're talking about mandates, this is not a mandate to get vaccinated. It is a mandate to make a decision. And if you choose not to get vaccinated, you're choosing the higher risk decision. And with that choice comes consequences. You may not have access to communities in terms of public spaces or airplanes, or someone may not want to sit next to you in a restaurant. And it's simply because you chose that higher risk decision. So I think that the responsibility does fall on the person, but it also has to understand that with each and every choice comes certain consequences that we have to live by.
I have a young son, and the pandemic started right before his birthday, right before he was turning 6. So when he was 5, and he was asking me, well, when is all this going to be over? And we thought, at first it was going to be this summer. And I gave all these, kind of false deadlines of when it's going to end. So this is kind of a selfish question. But how much closer do you think that we are to not necessarily a life without COVID, because that may not be possible, but less day-to-day fear about it?
I have to agree with those trajectories that were recently discussed. I think that when it comes spring, we'll be looking at a very different picture of COVID-19. I think, as you said, COVID-19 will likely always be in our environment. And unfortunately, as a physician, it will likely always be in my thought process when I'm trying to diagnose a new patient. But I do think that as time goes on, more people get vaccinated, and we start to see a tampering down of these rates of COVID-19 infections, hospitalizations, and deaths. We'll start to get some normal life. But we have to take that with a grain of salt and a moment of caution, because with each and every outbreak that exists outside of the United States, which is why vaccine equity is so important, it increases the risk of the development of new strains that can threaten all of our hard work. So it's just a point that we can focus on what's going on within the United States, but also paying attention and making sure that we take care of everyone outside of the United States as much as we possibly can.
Dr. Sutton, as always, thank you so much for your time.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.